Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Our talk today about portal hypertension. It's very important topics regarding hepatology. And as we know that the portal vein is not a true vein. Portal vein is not a true vein. And as we know that the blood supply of the liver is unique. It has a dual perfusion. And the majority of blood from the portal vein, about 75 to 80% of the blood supply to the liver is from the portal vein, which drains blood from the spleen, the pancreas, and the gastrointestinal tract, which is rich in nutrient but rather poor in oxygen. فلذلك it is not a true vein because it is rich in nutrient, while the minority of blood supply from the hepatic artery, So here, as we could see, the portal vein, which is drain blood from the spleen, from the pancreas, from the gastrointestinal tract, which is rich in nutrient, and is supply about 80 to 75 to 80% of the blood supply of the liver from the portal circulation, and the rest from the hepatic artery, which is about 20% or 15%, some said, or even 25%, from the hepatic artery, which is a branch of a celiac trunk of the abdominal aorta, and supply about 20-25%, which is rather poor in nutrient but fully oxygenated blood. And as we could see here, the portal circulation, the drainage of the blood from the gastrointestinal tract, pancreas, spleen, even the stomach, and to the liver. This is the anatomy of the liver. This is the abdominal aorta. This is the hepatic artery and the biliary passages, the portal circulation, and the hepatic vein and the inferior vena cava. As we could see here, the blood supply of the liver is mainly by a portal vein, as I said, and it's drain the blood from the spleen, from the pancreas and the intestine. It supplies about 75% of the blood. It's rich in nutrient and oxygen is poor. The rest is coming from the hepatic artery, which is supplied about 25% or 20%. It is a branch of the celiac trunk of the abdominal aorta, which is rich in oxygen and poor in nutrient. The rest of the blood is drained from the whole tissue of the liver back to the branches of the hepatic veins, then to the inferior or aorta, inferior vena cava, by the central veins, the sublobular veins to form the hepatic veins, then it enter to the inferior vena cava. And this is the biliary secretion. As we could see that the bile is an exocrine secretion. طبعا هو يصير concentration بالجول bladder, وafter the ingestion of a diet راح يصير construction بالجول bladder by hormone cholecystokinin, ويصير يعني secretion of the bile to the duodenum. This is the structural unit of the liver, اللي هي liver lobule. It is formed from a central vein. طبعا هو hexagonal shape, and this is the central vein, and this is the portal trade. ايش نقصد بالportal trade؟ هو portal vein, hepatic artery, and bile duct. All these three, هاي هي الثري نسميها portal trade. This is the unit of the liver. إذا أخذنا cross section of the hepatic lobule, راح نشوف هاي central vein, وهذا هو portal trade. This is the classical hexagonal shape of the liver lobule. This is anatomical unit of the liver. So this is anatomical function, composed from the one central vein and six portal trade, which is hepatic artery, portal vein, and bile duct. It is a hexagonal shape. Drainage of the blood from the periphery to the central while drainage of the bile في الاتجاه المعاكس from the central to the periphery. طبعا إذا أخذنا cross section of the liver lobule وأخذنا وحدة ثانية أيضا liver lobule نحتاج اثنين حتى نكون الليفر اسينس. الليفر اسينس هو الدايموند شيب أو هو lobulated shape اللي يتكون من two central vein and two portal trade. This is a functional unit of the liver. هذا anatomical unit of the liver, the classical liver lobule. بينما الاسينس liver اسينس, this is a classical functional unit of the liver. This is very important to know regarding the anatomy of the liver حتى نعرف البورتال circulation والhepatic circulations والarterial circulation. Portal hypertension. This frequently complicates cirrhosis. As we said previously, that majority of cases of portal hypertension are due to liver cirrhosis, يعني around 90% of cases. And we have other causes of portal hypertension. طبعا normal pressure inside the portal circulation is 5 to 6 millimeter mercury. Clinically significant portal hypertension is present when the gradient exceeds 10 millimeter mercury. فمن يعبر العشرة صار clinically significant يعني raised in the portal pressure. والrisk of variceal bleeding اللي هو المشكلة عندنا الرئيسية variceal bleeding, upper GIT bleeding, which could be very severe. The risk here when the pressure increased above 12 millimeter mercury. طبعا من يزيد عندنا البورتال hypertension راح يصير عندنا more congestion and more collateral circulation. Increased vascular resistance is a common in portal hypertension. طبعا causes are classified according to the site. فعندنا يعني extra hepatic and post hepatic أو sinusoidal, pre-sinusoidal and post sinusoidal. بس يبقى الاكسترا hepatic portal hypertension هو commonly occur in childhood and adolescent, while cirrhosis هو طبعا يكون majority of cases of portal hypertension اللي هو اللي نسميه الهيباتيك أو sinusoidal causes. This is the classification of causes of portal hypertension starting with the prehepatic, pre-sinusoidal. هذا هو ال prehepatic, pre-sinusoidal أو intrahepatic, pre-sinusoidal. Then the sinusoidal هو الهيباتيك. This is very important cause. The commonest cause was sinusoidal hepatic اللي هو liver cirrhosis. هذا prehepatic نقسمه prehepatic, pre-sinusoidal و intrahepatic, pre-sinusoidal. Then after that the intrahepatic, post-sinusoidal and the post-hepatic, post-sinusoidal. طبعا ال prehepatic, pre-sinusoidal, prehepatic, pre-sinusoidal mainly due to portal vein thrombosis like those due to مثلا umbilical sepsis أو thrombosis أو portal pyemia in newborn children and coagulopathy as well, or secondary to cirrhosis sometimes if there is portal thrombosis. أيضا يسمونه prehepatic, pre-sinusoidal. Abdominal trauma, any surgery, it may expose the patient to complication by portal vein thrombosis and portal hypertension as prehepatic, pre-sinusoidal. Intrahepatic, pre-sinusoidal mainly due to schistosomiasis. طبعا schistosoma mansoni اللي يصير أكثر شيء بالإيجيبشن المصريين. schistosoma mansoni ويسوي لنا portal hypertension وحتى pulmonary hypertension. بينما اللي عندنا بالعراق هي schistosoma hematobium اللي يسوي لنا hemorrhagic cystitis ويسوي لنا hematuria. Congenital hepatic fibrosis, drugs and sarcoidosis أيضا ممكن يسوي لنا intrahepatic, pre-sinusoidal. Commonest was sinusoidal mainly due to cirrhosis but could be polycystic liver disease, nodular regenerative hyperplasia and metastatic liver disease, which is very unusual causes. The majority of cases of portal hypertension is sinusoidal. Commonest cause of sinusoidal is liver cirrhosis. Intrahepatic but post-sinusoidal هنا veno-occlusive disease. Post-hepatic, post-sinusoidal Pocciari syndrome مثل يعني congestive cardiac failure, severe vena cava thrombosis أو congestive pericarditis and etc. The presentation of a patient with portal hypertension is mainly due to portal venous congestion and collateral vessel formation. And طبعا because of the congestion they will have a spleen, and with the spleen they will have hyperspllenism. وايضا هنا يقول لك يعني liver cirrhosis without spleen is unlikely, is very unlikely. اذا عندنا splenomegaly is a cardinal finding اذا هو بالliver cirrhosis. And the diagnosis of portal hypertension is unusual when splenomegaly cannot be detected. يعني اذا ما لقينا spleen اما clinically او by ultrasound فاذا الportal hypertension is unlikely. With the congestion there is collateral vessel formation, وهاي الكولاترالز ممكن تجينا على anterior abdominal wall ويسوي لنا caput medosa. Large umbilical collateral vessels has a blood flow sufficient to give a venous hump. احنا during auscultatory finding, auscultation of the liver عندنا 3 sounds. ممكن واحد عنده hepatitis نسمع عنده hepatic rub، ممكن عنده tumor عادة يكون vascular نسمع بروي أو murmur، وممكن أن يكون عنده venous congestion فنسمع venous hump. هاي during auscultation 3 important sounds. بالportal hypertension ممكن نسمع venous hump. The most important collateral vessels formation occur in the esophagus اللي هو esophageal varices ويسوي لنا bleeding. أيضا ممكن بالlower part of the esophagus and ويا stomach أيضا which can cause severe bleeding. بس ممكن أيضا نشوفها rectal varices and even hemorrhoids. هاي هنا من عندنا portal hypertension، شوفوا هنا cirrhotic liver with portal hypertension، شلون يصير عندنا backflow of the blood with congestion of the vessels and collateral vessel formation. يصير عندنا congestion بالstomach، وهاي طبعا بالlower part of the esophagus عندنا esophageal varices and etc. طبعا other manifestation and presentation of patients with portal hypertension خاصة إذا عندنا liver failure هو الفيتور هيباتيكس. فيتور هيباتيكس يعني فد ريحة نشتمها بالنفس تكون ريحة شوية عفنة، and this is due to shunting of blood which allows mercaptans أو ثيول اللي هو أعتقد يعني ثاني مثيل كبريت في الشيء، ثاني مثيل كبريتيد اللي هو الميركابتانز which pass freely to the lung and cause this bad foul smell. And ascites also important manifestation and presentation of patients with portal hypertension. هنا طبعا ascites and liver cirrhosis we have 3 causes، أما due to portal hypertension أو due to hypoproteinemia decrease oncotic pressure أيضا يزيد الاسcites، أو secondary aldosteronism يصير بالliver failure liver disease ويسوي لنا sodium and fluid retention. The ascites occur as a result of renal sodium retention. The most important consequence of portal hypertension is variceal bleeding. إذا عندنا مشكلتنا وخوفنا أكثر شيء من variceal bleeding يسوي لنا severe upper GI bleeding which can threaten the life of the patient which commonly arise from the esophagus. طبعا نشوفها دائما بالlower part of the esophagus or upper part of the stomach about 3 to 5 centimeters from the gastroesophageal junction أو من gastric varices. Variceal bleeding is often severe، من يصير عندنا bleeding يكون دائما severe. ليش؟ لأن هي varices وهي من هنا يعني دوالي مال المريء، وبعدين البيشنت هو cirrhotic عادة وعنده hypoproteinemia وعنده coagulopathy ودecrease بالclotting factors coagulation factor defect. فمن يصير bleeding يصير عندنا severe bleeding which is difficult to be arrested. And recurrent bleeding is very serious and very common, and if it is not treated طبعا it may affect the life of the patient. طبعا خاصة إذا وياها drugs patient ماخذ drugs like those drugs which cause mucosal erosion, for example non-steroidal anti-inflammatory drugs or salicylate or aspirin which can precipitate bleeding. What are the sequelae of portal hypertension؟ احنا عندنا portal hypertension نخاف من ال variceal bleeding، نخاف من ال gastric varices، congestive gastropathy، splenomegaly with hypersplenism، ascites، iron deficiency anemia due to blood loss chronic blood loss from peptic ulcer disease اللي هو associated دائما with liver disease أو from esophageal varices، renal failure and hepatic encephalopathy. This is a patient with massive ascites with dilated vessels due to cirrhotic نشوفها شوية emaciated wasted. And this is esophageal varices. This is esophageal varices. هي هاي الفاريسز نشوفها through the upper GI endoscopy. هنا طبعا دخلنا بالستومك هسه احنا ونسوي اليو شيب اليو مانوفر وراح نشوف الفندس. هذا الفندس وهاي هي الدايليتد vessels بالlower part of the esophagus وحتى بالستومك. But this is esophageal varices. Thank you.